Well, time is running out for the annual open enrollment period. If you haven't begun the process yet, your insurance agency can help. Joining us now, the president of your insurance company, Chris Carruthers, and senior director of Ambetter Broker Sales, Steve Samsel. All right, guys, it's crunch time. What do Nevadans need to know about the Affordable Health Care Act this year?
Sure. Good morning. Thanks for having us today. There's some exciting things going on with the Affordable Care Act this year, also known as Obamacare. This will be the 9th year of open enrollment for 2022, and there are some really exciting things that are changing. First and foremost, the law does not allow insurers to deny eligibility based on health conditions. They can't cancel you. They can't charge you additional premium. And there's additional tax credits or subsidies that are in place for 22 that will allow consumers to pay less for their monthly premium, as well as their deductibles and their out-of-pocket costs.
Well, that's good news. That's good to hear. So why should uninsured Nevadans enroll, Chris?
Well, the bottom line is that if they don't do it now, they're going to miss the opportunity to get insurance for next year. That's most important.
Yeah.
Because once you miss it, you lost it. But the other thing is there's two forms of help. We have help with your premiums through the federal government called tax credits, which they give you in advance to help you offset those expensive premiums, because we know how expensive it is. But also based on your income, we have what's called cost sharing reduction, which basically allows for the government to lower your out-of-pocket. In some cases, we have plans with zero deductibles and very low copays, so it's very affordable to use. So we have plans to help you determine what is best for you.
And even if you are insured today, there are some changes that are taking place come January 1st that could allow you to qualify for some additional benefits. So you definitely want to contact an insurance agent or agency like Chris's to make sure you're taking full advantage of your benefits for next year.
Yeah, it sounds like just from the couple minutes we've been talking, you've already mentioned some things that if I was to go it alone, I'd be in big trouble. So you're right. I think encouraging consumers to contact a local broker like your insurance is probably the smart thing to do.
Oh, absolutely. I think from my perspective, a broker is trained, they're certified, they're the experts that can help a consumer navigate the very confusing space about that health insurance is. And the thing for a consumer's perspective is they're going to pay the same, regardless if they choose to enroll on their own or if they consult a certified professional like Chris.
Yeah, for sure. All right. So the big question, you sort of mentioned it off the top, is when is the deadline and where can viewers go to find qualified professionals?
Well, they can go to, the deadline is going to be December 15th, and then go to our website, yianb.com, but also they can stop by one of our retail locations. But keep in mind, please, be careful of the 800 numbers and be careful of the internet, because that's where scams happen, where you're not buying the real thing. You may be buying something that's not going to cover you when you really need the care. So be careful. Seek the advice of a broker. It costs nothing to have a broker. We're free. We're compensated by the carriers to help you. So reach out to us. We're ready to help you and serve you and be there for you for the long term.
That's amazing. Yeah. Good to know that. Yeah, you guys, we're not paying you. You guys get taken care of elsewhere. And like you mentioned, with I didn't know about the tax credits, and people that do have, if they're in poor health, there is relief for them, and they shouldn't. It's not like they should just not do anything.
Correct.
Yeah.
Correct. Yeah. We see people with practically paying zero premium for their plan on up.
And don't procrastinate. The deadline is December 15th, but if you plan on needing to use care or access your doctors for January 1st, get enrolled today. It gives the issuer opportunity to send you your ID cards so that if you need to go to fill a prescription or go to the doctor on January 1st, you're ready to use your coverage.
All right, guys, your insurance agency, I really appreciate it. Great advice, and we'll talk to you later. Thanks.
Thank you.
All right, Cassandra?